It seems many people around the world are losing more sleep due to the stress and strain of the pandemic. A survey on 13,000 people in 13 countries found 7 in 10 people have experienced sleep problems since the pandemic broke out. They cited problems such as waking up in the middle of the night, inability to fall asleep, and maintaining sleep. Now, sleep is an essential and universal need for the human body. Yet in a fast-paced urban society, especially like South Korea, getting a good night's rest has become something of a luxury. Now, Dr. Arirang is one of South Korea's leading sleep psychologists and a professor of psychology at Seongshin Women's University, who researches and develops behavioral sleep medicine, including those for sleep disorders. We connect with her today and look into why more people are tossing and turning at night over the course of the pandemic and what can be done to help us get a good night's rest. So welcome to the show again, Ali. It's so lovely to see you. How are you today?
Good morning. Good. How are you?
I'm good, thank you. And well, we've had you on the show before, but well, of course, your main research focus is sleep and sleep disorders. And well, first of all, I really want to know what made you pursue sleep psychology, especially in a society like South Korea.
Sure. Thank you for having me on the show. I'm a clinical psychologist by training, and a clinical psychologist is a profession that works with individuals with mental illness. And when I was in graduate school, my primary focus was working with individuals with chronic illness, such as cancer or lung disease. And many of these individuals were struggling mentally. And I found through both research and clinical practice that sleep was really a common denominator for many of these individuals. And improving sleep really helped the quality of life for many of these patients. So when I moved to Korea, what I found was that people weren't really that interested in sleep. However, research shows that in Korea, 1 in 10 people suffer from sleep disorder that merits treatment, and 1 in 2 are dissatisfied with their sleep. So I think over the years, many people have really started to understand that sleep is important, and that if you can't sleep, you really need to get checked out by a professional. So the market is also really selling good sleep and is currently at 3 trillion won, and it has been really increasing exponentially over the years. So I think it's safe to say that Koreans are very interested in sleep, and sleep is very important in Korea as well.
But as you said, sleep, maybe the nature of capitalism or how our societies are today, it's been encouraging us to have less sleep and have more time for productivity. But why is sleep so important? I mean, how does the quality of sleep affect mental and physical health?
Sure, and that's a great question. You know, we spend 1/3 of our lives sleeping. I mean, if that means that if we're living to 100 years, we would be spending approximately 30 years sleeping, and that's a really long time. And research has shown that if you don't sleep, if you cut corners, it basically affects every aspect of your life. Mentally, you're not able to concentrate or remember things, and it puts you at risk for a lot of mental illnesses such as depression or anxiety. I'm sure if you've lost sleep over the night, that you've noticed that it puts you in a bad mood during the day, and it makes you more anxious. Also, some other things that we found is that it makes you more vulnerable to drinking alcohol or smoking more and using other substances which aren't very good for you. Physically, research has shown that if you don't sleep well, you are at risk for heart disease, metabolic conditions such as diabetes, obesity, and even premature death. If you don't sleep well, you're going to die a little bit early. So needless to say, it is really important to sleep.
Well, how much sleep should people be getting on average?
And that's an interesting question because there isn't one clear-cut answer for everyone. Everyone has individual sleep needs. We found that the average falls between 7 to 9 hours for adults. Children and teenagers need a little bit more sleep. But the real index to finding out whether I'm getting enough sleep is figuring out how I feel during the day. If you're not nodding off during the day, during conferences or during class, if you're alert and you're able to concentrate, then that probably means your sleep is okay. But if you're feeling tired during the day and you're falling asleep when you're bored, then that probably means that you need to catch more Z's.
And of course, the COVID-19 pandemic's really disrupted our lives, and now it's keeping us up at night. How have stress and changes in lifestyle caused by COVID-19 affected sleep?
Sure. So COVID-19 definitely has changed the lifestyles of many people. And some of the sleep studies that have come out during the pandemic have found that compared to before COVID, many people are actually sleeping in before COVID, many people were sleeping in during the weekend compared to the weekdays. However, with people working from home and being able to keep your own hours, many people have started going to bed later than usual and waking up later. They're also sleeping more. Research shows about an hour and a half more, but they're also sleeping really late and waking up really late. And there are also more reports about people having more vivid dreams and nightmares. And quite a few people are also saying that they're experiencing insomnia. There was a term that came out at the beginning of the pandemic called Coronasomnia, which is kind of a hybrid between the words corona and insomnia. And also, when the pandemic first happened, I think it was so unexpected that people were very worried and felt very stressed about the situation. And our bodies are designed to stay awake and tell us to kind of keep on guard, our guards up if we feel any type of threat. So I'm sure that a lot of people were really worried and were losing some sleep because of the pandemic.
And well, you've studied the relationship between smartphone usage and sleep, and I think that's actually how we met when I was reporting on your research. And well, over the course of the pandemic, we've been constantly looking at our screens and seeking digital solutions to work, education, and entertainment, etc. And well, how does this sort of affect the quality of sleep?
Well, there isn't any real conclusions that have come out, but there are some research that shows, especially in our lab, we found that individuals who kind of go to bed later than intended without external reasons for doing so, we call them bedtime procrastinators. And what we found is that individuals who are bedtime procrastinators stay on their phone almost 4 times longer before bedtime than those who don't procrastinate. And we found that the main reasons are due to feeling bad emotionally before bed. And when people are on their screens, and if they do that day after day after day, it does affect sleep quality because you are getting a little bit of that bright light before bed, but also you're delaying sleep and you're not going to bed at the optimal time.
So, well, after the pandemic, it's expected that more and more workplaces and schools, they're going to keep on adopting digital solutions. So do you think sleep quality then will become a growing issue of concern? Do you think it should really receive more attention from public health authorities and policymakers as well?
Sure, absolutely. And I actually already think that sleep quality is an issue of concern. A lot of individuals don't get enough sleep. Research shows that if you get less than 5 to 6 hours of sleep, it does have a detrimental effect on your health. But on the contrary, a lot of individuals don't really put a lot of value in getting more sleep. They don't think that it's important. So it's not just an issue with digital solutions. It's also, as you mentioned before, individuals, people feeling more competition, feeling the need to work more and putting less value on sleep. So, I'm very much a big proponent of learning more about sleep. I think we should learn more about sleep in the school curriculum. I think there should be more public awareness and campaigns about the importance of sleep. And really, I do think the society would be a better place if people slept more.
Now, what is sleep hygiene and what are ways to practice it?
Sure. So sleep hygiene is a good way to prevent any type of sleep problems. If you have sleep problems, then you should definitely go seek a professional. However, if you are kind of, on the brink of not getting enough sleep and you feel you can do a little bit better, there are some things that you can do in terms of behaviors to improve your sleep. And just to give you a couple of pointers, the first one is, waking up at the same time every day. I know that in the weekends you maybe be tempted to sleep in a little bit longer, but you should wake up at the same time. There's also a term called social jet lag that's associated with this. So if we go overseas and there's a time difference, you'll find yourself kind of in a place with a different time zone, and you'll feel jet lag. You'll feel more tired. However, social jet lag is kind of giving yourself the jet lag by waking up later on the weekends. So so you should try to avoid any type of social jet lag. If you are going to sleep in on the weekends, then make sure that you do that within 1 hour of your normal sleep time. Another one is differentiating your night and your day. So if you can differentiate, make sure that you're not sleeping in too late during the day and then waking up too late during the day. Another one is having a type of buffer zone before you go to bed. So most people, they think that they can just close their laptop and roll into bed and they'll fall asleep right away, but that's not the way that our bodies were designed. So you should actually have kind of a period right before bed where you're relaxing and making sure you're getting into the right mindset of going to bed so that you have higher chances of falling asleep a little bit faster. And another one that people really don't really take care of is being aware of the caffeinated beverages that they're drinking. That includes coffee and green tea, even chocolate. So if usually the time that these caffeinated beverages stay in your body is 6 hours. So you should avoid any type of caffeinated beverage 6 hours before your bedtime. And the last tip that I wanted to give you is using your bed only for sex or sleep. So if you're in bed and you're reading or you're on your phone or you're eating or any type of other activity other than sleep, what is going to happen is that your brain is going to be very confused. It's going to think, well, I thought my bed was supposed to be used for sleep, but now I see that it can be used for worrying and being on your phone. And so what happens is that it lowers your chances of actually sleeping better.
Well, I'm devastated about the chocolate part. No chocolate 6 hours before sleeping.
During the day.
Well, of course, you're also working with major hospitals in the country to work on ways to help people sleep better, and this includes sleep aid devices. So what are some of your current projects?
There's a lot of movement towards digital healthcare, and so a lot of people are trying to reach out to the people who actually aren't able to get to a hospital or get to a clinic to receive the care they need, and maybe doing some type of self-help activities, such as the ones that I introduced before, and tracking them with their phone is very interesting right now, in a very interesting area. So those are some of the things that we're working on in terms of doing some outreach.
What are the signs that your sleeping habits might need professional attention and care? What kind of help or support is available?
Well, there are many kinds of sleep disorders, but the most common ones are insomnia and obstructive sleep apnea. So in terms of insomnia, if you're taking more than 30 minutes to fall asleep, or if you're awake in the middle of the night for more than 30 minutes, or you're waking up too early in the morning before your desired wake time and you can't get back to sleep, it probably means that you do have insomnia. And if these sleep problems are especially causing distress for you and getting in the way of your daytime productivity and concentration, then you should definitely think about seeking professional care. Currently, treatment can there can be two different types of options. One is the pharmacological option, and one is the non-pharmacological option. Currently, the first line of treatment that is recommended for insomnia is cognitive behavioral therapy for insomnia, which is a form of psychotherapy that you can get from a licensed psychologist like myself or a psychiatrist. And what you do is you go in for a normal therapy session. And another alternative treatment is getting sleep medication from seeing a doctor. There's also currently many available self-help books and apps that you can use to kind of improve your sleep. And the second sleep disorder that I mentioned earlier is obstructive sleep apnea. It means that you're not really breathing the way that you should during your sleep. And some signs are if you're snoring too loudly during your sleep, or you're waking up kind of out of breath, you have dry mouth in the morning, things like that. These are some common signs that you should definitely go in to the hospital to get a sleep study, and also get yourself checked out to see if you have any other type of sleep disorder.
Oh, well, I suppose those are some good ways of checking whether you should really seriously consider getting professional help or not. And well, I'm afraid this is where we have to end the interview today. But that was Dr. Arirang, Professor of Psychology at Sungsin Women's University. Thank you again so much for your time.
Thank you for having me.
And to our viewers, as always, thank you very much for watching.